this is a film that emphasises, better than many other films I've seen, the importance of person-centred care, treating people as individuals and putting the person first rather than the disease first. The primary target audience is healthcare professionals, but I think the reach and the strength of the film is such that it could be used by anybody who works in a care home, who visits a care home, who owns a care home. First and foremost, it should be used to raise awareness of dementia. There are a number of things that I think that people would be able to learn. One of the things is to be aware of the majority of people in care homes have dementia or a significant degree of cognitive impairment. I think the second is that understanding the way that dementia can affect an individual, and it can affect their families, and it can be influenced by the environment. We know that looking after a person with dementia is very, very stressful, that being a carer in a care home is probably one of the most difficult jobs that there is. So supporting care staff and understanding the stresses and the strains, and in the film that's brought out very well. But also the other side of that, once that understanding is there, once that person-centred approach is there, it's such a fulfilling job to do. Patience was able to live well with dementia, that understanding her lifestyle, her likes and dislikes was so important in making sure that her experience of care was as good as it could be. So there's so much to understand, and there will be many things that people watching the film, there'll be a phrase, there'll be something that they'll pick out that'll strike a chord. And so I think that's where the real learning is. For me, my personal feelings are that it really emphasises that with that individual approach that you can really transform the care of a person in a care home. And I think every healthcare professional and anyone involved in the care home sector would do very well by watching this film and just thinking about it.
That'd be great. Okay. Yep.
I'm really sorry, but Julie's called in sick.
That means we weren't shot again this morning.
I know, it's this wretched bug that's going round. She's not the only one either. I've rung the agency, but they'll struggle to get anybody here for the few hours.
And in the meantime, how are we supposed to cope?
I'm sorry, it's just such short notice. We'll just have to manage. If there's anything I can help with.
Oh no, don't worry. I'll be okay.
Thanks, Laura. I'll make sure the rotas are fully covered for the rest of the week. I'd better dash now. New residents arriving.
It's difficult for all the support workers.
See you later.
I mean, we really do try our best. But the problem is you're often understaffed. The hours are long for the pay. It's exhausting.
Where is this?
It's the care home, Mum.
Hi.
Hi.
Hello again, patients. Welcome to Sunshine Valley. It's Sarah. We met at the hospital. And this is Mia. She's going to be looking after you today.
Hi, Patience. Is it all right if I call you that? I'm Mia, by the way.
Take me home. Take me home.
How about we get you settled in and then I'll show you around if you like?
Take me home, please.
Mum, they're going to take care of you.
I want to go home.
What a day today, Patience, huh? How about something nice to wear to cheer us up, perhaps? What about this one? Or this one? Bright? Dark?
I don't have time for all that. Donovan will soon be here to pick me up for church. My husband is always on time. A very punctual man is Donovan.
Come on, Patience, haven't got all day. Which one is it?
What you doing? Who do you think you
Patience.
is? Where is Donovan? Get him!
Patience,
Donovan!
calm down.
Donovan!
Get your dress.
Donovan! Donovan! Where is he?
Hi, Patience. It's Mia. Are you all right? Look, you seem a bit upset. Can I help you?
Where's Donovan? We going church.
Oh, of course, church. Your son Elliot told me all about that. You said you really enjoy church and that you sing in the choir, is that right? Did you know we've got a choir here? They practice every Wednesday afternoon, which is tomorrow. You can come and join in if you like.
Elliot, he's a good boy. He's my only son, you know.
He told me you've got a beautiful singing voice. Listen, do you want to see what's happening on in the lounge? Maybe we can have a cup of tea. I think it might be tea time.
You should have seen my Donovan. Tall and handsome. He was a perfect gentleman.
Well, of course my dementia training helps, but dementia affects everyone really differently. So it's about getting to know that person, and that takes time. But it is worth it in the end. It means that you can care for them with respect and treat them as an individual.
Listen, I wouldn't be doing this job if I didn't care. But sometimes when you're tired and understaffed, it can make things really difficult. A person with dementia isn't always aware of time or where they are. When they're confused, what's in their mind and what's really happening now can make them feel lost and disorientated. That can make the job challenging.
Right, I just need to take your blood pressure, and this won't take long, so here we go. There we are.
That's all right, you just hold my hand, okay?
Hi everyone. Hi patients. Are you okay? Shall I put on one of your CDs? How about this one? Or maybe this one? I'll put this one on. Looks good.
Wouldn't it be? Damn hanky. Sure it was here. Oh.
What's
I
that?
had minded back in Backtra. Donovan! Donovan! Donovan!
Come on, patience.
Shut up! Donovan! Shut
Come
up!
on,
Donovan!
patience. Don't be like this.
Shut up! Donovan!
I don't know. I
Donovan!
just put on some music I thought she'd like.
Donovan!
She keeps asking for Donovan.
No, it's the hanky.
Donovan!
It's in the reminiscence box. Can you go get it from the room?
Donovan!
Sure.
And I'll say with patience.
Donovan!
Patient, why don't we try and speak to Elliot? He said he was looking forward to speaking to you. How about we do a video call and then you can see him too? That's it, come on, let's sit down. And we'll get your hanky. Careful, careful. Right, here's your hanky. Here we go. There's Donovan's hanky. There we go.
Patience never goes anywhere without that hanky. It wasn't really the agency staff's fault, you know. I mean, maybe they should have had a good look at Patience's personal profile, but really, it was our responsibility to make sure that she knew that information. But sometimes when it's busy and the regular staff aren't in, then things get missed.
I mean, she's not normally like that. She can be difficult at times, but not like this. Music can be a powerful therapy, but it can also have the opposite effect. But I don't think it was that. After we referred her to the GP, we found out that she did have a UTI. She must have been so uncomfortable. Poor woman. I'm really glad I trusted my instincts. You know, you've just got to watch out for this kind of stuff because a person with dementia can end up in hospital with a much larger problem. Okay, we're just going to brush your teeth, Shirley, okay? Just get the toothpaste on. Okay, Shirley. Here we go. There we are. A good supporting team is really necessary. That's it. Our manager understands this and encourages us to be proactive around delivering care.
Yeah, and you know, we spend a lot of time giving feedback, sharing feedback, just talking to each other, really, so that things don't fall through the cracks. okay. Just let him do his job. Won't be long. Okay. Just hold my hands. It's all right, Patience.
Lovely.
All done, you see.
Thank you very much. Hi, Mum. Mum? You alright?
Donovan?
No, it's me, Elliot. You alright? Look.
Hello, Nanny.
Donovan? Who is she?
It's your granddaughter, Chantel, Mum.
Chantel?
Yes.
Nanny, it's me, Chantal. Why doesn't she know who I am?
Chantel. Chantel.
Are you all right, Chantal? Oh, do you want to talk to me about it?
Why doesn't she know who I am? It's not fair.
Oh, I know, it's really upsetting when someone you love doesn't recognise you. But that doesn't mean she doesn't love you. It just means that her memories are like jumbled up books in a bookcase. And sometimes she'll struggle to find the right book with you in it. But that doesn't mean she's lost you forever.
Really?
Yes. Look, what's important is that you know you can talk to her and remind her of who you are and all the fun times you've had and that you really care. All right?
All right.
And I promise you, I will do all I can too. All right? Should we do it together?
Okay.
Good girl.
What are you doing today? You okay? Think we're all done here? Yes, thank you. Yeah? Okay.
Patience, the doctor's here to see you now. He's going to take your temperature. In the final years, it's the little things that make all the difference. Things like not overfilling hot drinks.
It's about understanding the person behind dementia. I think, you know, obviously there's going to be a time when it's harder to talk. But no matter what, we're still here. I think you've just got to be creative, you know, knowing what ticks for them, knowing what works for them, knowing their needs. You know, treating them with the utmost compassion, respect, dignity, making sure that they're clean, safe, properly cared for. That's what I'd want for my family member.
You know, you've got to keep on engaging with a person with dementia so that they can make their own decisions for as long as possible. And that takes time. And it takes patience.
Why do I do this job? Because I love it. I mean, yeah, it can be hard at times, stressful, the hours come along. I do get the residents really need me. And I can make a difference.